Good morning, everyone. We'll give folks a few more minutes to log in and then get started. All right, it looks like we have most everyone logged in. So I will run through the agenda. Actually, our agenda is pretty set in terms of it doesn't change much from week to week. So are there any areas that folks have questions on or things we need to add into the agenda? Okay, you can always wave to me or stick those in the chat if anything comes up, and we'll be happy to follow up and answer those. So starting off, Steve, if you'd like to give us an update on the dashboards.
Great. Good morning, everyone. So cases continue to decline, albeit at a slightly slower pace. Last week, so between February 21st and February 27th, there were 598 new cases reported. There were 684 the previous week. That takes our daily average down to 85, where it was 98 the week before. Of those cases, 439 were confirmed, 79 were probable, and 80 were unassigned at the moment. Our 2-week total, so between February 14th and February 27th, we had 1,282 cases. The prior 2-week total was 1,418. For age groups, we're still seeing 20 to 29-year-olds at the most cases coming in with 20%, 30, 39-year-olds are 15%, then it's pretty spread out evenly, except for the older age brackets, which are very low, between 5 and 1%. So, and that's over the age of 70. For race and ethnicity, white cases are at 81%, Hispanic cases at 5%, Black cases were at 3%, and then 2 or 1% spread being the other groups. For our rate per 100,000 cases in the past 2 weeks, we are down to 249. It was 275 the last week, so it's a 9% decrease. We had 30 new Spokane County residents hospitalized between the 21st and 27th. There were 35 the previous week. Currently hospitalized in Spokane County, so that's with all of our systems, is 51 individuals. Unfortunately, we did have 6 new deaths last week, an individual in their 40s, 2 individuals in their 70s, 2 individuals in their 80s, and 1 over the age of 90. There were 13 deaths the previous week. Our testing is down slightly. For the total tests of the last week, we had 5,174. It's about 1,000 more the week before. That takes our average number of individuals tested daily down to 739. That's a decrease from 878. Our test positivity is just about the same. It's slightly higher at 10.2%, where it was 9.6 the week before. For healthcare system readiness, the number of staffed beds available currently are not available. Total is 1,070. There are 1,501 licensed beds. Total occupied census for staff beds is at 78.4%. For licensed beds, it's 55.9%. Our total COVID census continues to decrease at 4.8% for staff beds and 3.4% for licensed beds. And there are 0 surge beds in use at the moment. For case and contact metrics, we investigated in-house 510 cases last week. That's 583 the prior week, so about the same. And we reached 75% of those within 24 hours. Our isolation facilities continue to serve those who need. Our hotel census as of yesterday at 4 p.m. was 1, so very low census at the moment. The Immaculate Retreat census was at 18, so 30% of their capacity. Our business technical advisors continue to work with the business community. From May 27th to February 28th, they have done 6,341 consultations between February 22nd and February 28th, they completed 142, and they have done overall 6,105 complete referrals. For our unemployment insurance claims, those continue to go down slightly between February 14th and February 20th. There were 870 new claims for unemployment insurance. There were 974 the prior week. The industries impacted most continue to be specialty trade contractors and food services and drinking places. And then continuing the good streak with protecting high-risk populations, we have had 0 new facilities reported for long-term care facility outbreaks. There have been 89 total, and there are 11 currently under active outbreak status, which is down by 4 from last week. And that concludes my report. If there's any questions.
Any questions for Steve before we talk to Dr. Velasquez? The numbers are a little different this week, but still moving in the right direction. So that's positive for our community. All right. Doesn't look like there are any questions. Dr. Velasquez.
So good morning, everybody. I've been trying to play with my blinds because the sun is out there. I'm trying not to get blinded, but also trying not to be on the dark side of the moon, but I can't seem to figure out this office. Anyway, before I talk about 3 things, I just wanted to highlight something that Steve mentioned, which is testing rates down a little bit. And I just wanted to put that within the context of the rest of the country, because we're seeing the same trend pretty much on a national level. There are many counties, many states around the country that are running 30, 50% capacity of testing. And I usually get asked, so what does that mean? And there's a number of factors. So I wanted to just put those out there so we all have the same information. First and foremost, well, there's less exposure, there's less travel. We're over all of the holidays and Valentine's and anything else that will prompt people to move around a lot. So that certainly helps, because with holidays, we saw a lot of travel-related testing either before or after. And we also know that we're at a point where the clinical diagnosis is pretty straightforward. We know enough in the vast majority of the cases. And then lastly, there's a little bit of pandemic fatigue with testing as we're focusing a lot on vaccine. So all of that contributes to that. It's not a good thing or a bad thing. It's just a basic fact of where we are in the pandemic at this point in time. We continue to encourage testing to be used clinically as appropriate. And that message continues to resonate with our healthcare providers. So I just wanted to highlight that for a second, because that's a question that is coming up in more than one scenario. So I wanted to focus on 3 things today. And first one being, if you saw the front page of the paper, we have some of our high schoolers back. And some of the older grades are coming back between now and April, which is good. And I was, it's a little bit heartwarming to see those students in North Central High. When I was at PAML, we used to go and do lectures at North Central High and their science program, where we had 9th graders doing whole genome sequencing. So there's a little bit of emotional attachment to that. So it's good to see they were all masked, socially distanced and behaving, which is good, as they should. But I wanted to share with you, as we work with schools, we did a survey of all of our school partners between encompassing the period of January the 11th, when we started to move forward, all the way through February the 13th. And there were a number of questions. I'm not going to go through all of the survey, but I wanted to highlight a couple of things I think are very important as we continue to onboard, particularly the older students. And the reason why I say that is, remember that older students start to approximate adults in terms of transmission rates, as opposed to those that are, 2 to 10 and 10 to 18 and then beyond that. So first, on the very positive side, when we interviewed the school staff, there was significant support for administration for the efforts on the COVID response, including the scaling up of the COVID response teams at the schools. And that's very important. It's one of the requirements that we put in our agreement with them, and the schools are doing a good job with that. And if you track the numbers, other than that isolated case of a contracted bus service, I think the numbers have been fairly good for the most part as we go forward. One of the areas that was really good too is compliance with all of the guidance from students, staff, and faculty at a very, very, very high level. So thank you to our teachers and principals and school staff and our students, of course. Keep behaving, wearing your mask, and doing what your teacher tells you to do. Where we saw a little bit of challenge is, interestingly enough, with parents. Parents are not as compliant as are the students, the staff, and the faculty. So I just mentioned that mainly so as we talk to others, we can emphasize that. And my daughter is a teacher, and she told me that's fairly true, very true, that students, staff, and faculty are very compliant, but then parents are not really necessarily following the rules as well. So we want to encourage our parents to be diligent, particularly as we bring the older students back to school. And we're having the same conversation as we talk about things like potential graduation events and ceremonies. With you can do all the social distancing and crowd control, etc. But if there's no compliance, then a lot of those measurements are not going to be as effective. So we're taking this opportunity to emphasize that. We share that with our partners in higher education, so we can start to put that message out that we keep looking forward to what else can we do in the community, but we can only do that if we all continue to really follow the guidance and be very, very, very diligent. We worked really hard to get to where we are. We want to make sure we protect that gain. So I wanted to share that with you because we have spent a lot of time with education over the last, particularly since mid-December, and we're seeing the results of that, and it's quite encouraging. So thank you to our school partners for their diligence. Second is I want to talk a little bit about testing, not diagnostic testing, but other types of testing, and specifically on antigen testing. As we start to move more into the community, we are launching between this week and next week 3 pilots for deployable testing in the community in 3 different areas to start to develop models that will allow us to scale up, and also that will allow us to collect some data that can be applied to similar environments. So we have a pilot that is going to occur between the district and one of the school districts, East Valley School District. As you know, some of our schools are participating in the Department of Health Bill and Melinda Gates Foundation funded project for testing, so it's a little bit different. But we're deploying an antigen testing pilot study focused on higher risk areas, such as special ed classrooms and so on and so forth. So more to come on that, because between that and the models that the Department of Health is deploying, I think we'll have significant information applicable to school. So that's the first one. The second one is we have a kind of like a singular opportunity with a venue and performance and staff and production staff in a very controlled environment. And the reason why I highlight very controlled environment is because it's extremely well-controlled environment, not only from physical facilities, but also number of people. So one of the other pilots that we are in the process of moving forward with is by utilizing the symphony's spring rehearsals at the folks where you have staff, production staff in limited capacity, as well as musicians fully masked with the slit mask and the social distance and all of those things. So that will give us a little bit of information as to what does it look like when you have music events beyond what we've done with schools. And the reason why that is important, if you think about it, a lot of the events that we contemplate in the community between now and next spring are around performance. So that will give us a little bit of information that I think will be extremely useful. And then the last one, and all of these are coming out of our testing task force. The last one is part of our equity group. And actually, we are deploying in partnership with Range Community Clinic and WSU, utilizing some of our WSU students and practitioners. We're going to perform testing in 3 to 6 locations, basically around some of the food distribution venues where we can really go to some of the people that may be at risk and may not have the access that is needed, and or may not have either the confidence or may have language barriers. There's a number of issues that we're trying to address there by working with the local food banks. And we are getting ready to complete the protocol on that because that's a little bit more complicated. But the goal is to try to go to some of those areas where we may have some of the high risk transmission environments that may be less controlled than like shelters, for example, where we've done a lot of work with. And not only provide testing, but also provide guidance, provide those that are there with COVID care kits, et cetera, et cetera. So more to come on that. We are currently looking at potentially another 3 pilots focused on retail in similar environments to that. And I've gotten a lot of suggestions about potential environments. So we're trying to assess through those. Ideally, we would like some local venues so we can extrapolate to other local venues that are similar, particularly on the retail side. So those are 3 pilots that are coming out of the testing task force that are moving forward. And then lastly, as we all know, we've been talking about phase 3 for the last week or so, because we are all interested in what is going to happen there. So I just wanted to share with you that there's a small group that has been put together by the Department of Health to start to talk about that. And I'm in that group thanks to Amelia and the team here. We raised our hands and jump up and down and say, hey, we're here, ready to go. But the important thing behind that is our epidemiology team here has put together some suggestions as to parameters that could be useful for community that could be applicable at a community level and be reflective of the pandemic and the stage that we are at pandemic. As an example, if there's a concern about, obviously, clinical capacity is always an issue of concern, like hospital capacity, et cetera. But so are things like if our highest risk population 65 and over, we should be able to look at the safety, transmission, and herd immunity in that group very specifically, for example. So there's a number of areas that we'll start to look at. Today is the first conversation tonight, and very happy to be part of that. And Millie and I have talked about that a lot internally and with the team. It's a very common conversation. So we're excited to be part of it. And thank you to many of the people in the community that have made suggestions. But I just wanted you to know that we're part of the conversation. We do believe that the conversations will be heard. I don't know what the outcome is, but our experience, and I think Emily and I have talked about this, our experience with Secretary Shaw is he is interested in having a conversation, listening to what the stakeholders have to say. Now, at the end of the day, obviously, there's some decisions that will be made, and we don't know what those are. But if nothing else, I think being at the table and part of the conversation is always important. So we worked really hard internally to make sure that we could have that opportunity. So I just wanted to share that with you so you know. And don't know, there's projected that we'll be meeting for the next week or so, multiple times. So I'm assuming that that means that we're starting to think about what it will be phase 3 like. So I'm going to stop here and see if anybody has any questions for me, and I'll be happy to answer those. Commissioner.
Yeah, thank you, Dr. V. So just so excited to see schools, high schools getting back and middle schools. I know for our community, and you guys have worked really hard with the school district. So I just want to say I've heard from superintendents how grateful they are for all the work that you guys have put into it and all that you're doing in that area. And so thank you, as we know, for the mental health for our students, for the mental health of our parents. It's important to get kids back. You know, and we're seeing our numbers are down, you know, coming down. You know, hopefully we're going to see that trend continue. I know, you know, there's a little bit of concern of, you know, with kids being back, but the teachers are now, you know, maybe meeting after school now that, you know, some places are open. So just hoping that people still keep doing everything they need to do so that way we can keep students in and keep our restaurants open. So just, you know, thank you for all you're doing, and just a caution for all of us that we need to keep being vigilant and doing the right thing.
Thank you, Commissioner, and I couldn't have said it better. So everybody keep up the good work. Now it's time to be diligent, and thank you. I think the team here has worked really, really hard and continues to work hard. This is a daily occupation for us here, but we are focused on keeping our students in school, because that is, at the end of the day, the safest and best place for them to be. If we can maintain that safety net around them, that is, it behooves all of us to make sure that that safety net stays there. Thank you.
Dr. Velasquez and Amelia, this is Mayor Woodward. Sorry, I am in a place where I really can't use video, but I just wanted to say how grateful I am that you are part of the conversation with Department of Health about what phase 3 looks like, because I think the state needs to listen to stakeholders on this side of the state. Just want to let you know that I was able to meet with the mayors of the East region, and we did send on Friday a letter to the governor with 19 mayors' signatures of suggestions on what phase 3 might look like from our perspective, and had a meeting with the governor yesterday. It was well received. So nothing outrageous was asked. It was just basically building on the benchmarks that we already have, and just expanding, opening many different business sectors and events. So thank you for all your work, and just so happy to hear that you will be part of the conversation. Thank you.
Thank you, Mayor. And I have the whole team behind me here. They're providing as much information as we need to have reasonable science-based recommendations, and applying a little bit of common sense and logic to the science, which is always the way these things work in public health. And as you may recall, when Secretary Shaw was visiting here, that was one of his statements that resonated with me, which a lot of this is basically common sense, fueled by science and knowledge, but common sense at the end. So we'll do that, and we'll keep you appraised. Between Amelia and I, we participate in many groups, so we'll keep everybody appraised of our progress. Thank you.
Thank you, Dr. Velasquez. Want to shift to Tiffany to give us some updates about the general response. I know we continue to have questions and comments that come here to the health district about vaccines, so I'm sure that will be touched on in Tiffany's report. And then if you have questions, you know, put them in the chat, or when Tiffany's done, we'll ask for those. Go ahead, Tiffany.
Good morning. So yeah, some great encouraging data and news from Dr. V and Steve this morning. And so we also have some great news on the vaccine front. So in Spokane County, we've vaccinated over 105,000 1,000 doses in Spokane County, which is encouraging. And then we also, most of you have probably heard, Johnson & Johnson, it has now been approved as the third vaccine available, which is really great. So we expect to see some doses coming from them here in the next week or so. And it's exciting because the Johnson & Johnson vaccine is a one-dose vaccine. So it allows us to really utilize that vaccine for some of those harder to reach populations, to where it might be a little more difficult to get that second dose to them. So we're doing some planning around how we're going to utilize the new Johnson & Johnson vaccine. We've also seen a pretty big increase in vaccine that's available in our communities. So Chaz Health has now set up some public clinics this week and vaccinating. They received quite a number of doses this week, and so they're partnering with Gonzaga to make those doses available to both their clients and to the public. And we're also seeing Providence has opened some additional clinics this week, and then many additional pharmacies within our community have vaccine appointments available now. One big change that we've seen in the mass vaccination site is that now that Chaz has kind of their own vaccine distribution program that they're doing with Gonzaga, is now Safeway has stepped up and is going to be the vaccine provider and partner with Department of Health and National Guard at the mass vaccination site at the arena. So that's really exciting to have a big private partner come in and help facilitate the vaccine management piece of that. As far as the health district, we're really focusing on, with the vaccine that we have, is really focused on the providing those second doses in those community clinics and with those partners that we have. And again, focusing on those marginalized communities. We have another clinic, I think it's today, in fact, at the Martin Luther King Center. So really focusing on those that are disproportionately impacted by the pandemic. We're also doing some planning around how we're going to reach some other more vulnerable populations. So looking at some of the more rural areas and how can we ensure that vaccine is available in those rural areas. And then also taking a look at how we're going to plan for vaccination of homebound. So pretty big lift there because it's going to take a lot of individual work and outreach there. But we have started conversations with many partners and are hopeful that we can be able to manage that piece as well. We're also just had a planning meeting yesterday on looking forward to the next tier. So the next tier that the governor will open for vaccination is the 1B2, and that's those that are 50 and over, high risk employees that are working in congregate settings or that aren't able to mask or physical distance. So, those can include food processing plants, some of the additional school staff in K through 12, and some of the additional first responder community. So a lot of different congregate facilities that we're going to be looking at and trying to identify where the gaps are and how we might be able to partner with some of our other agencies to be able to get vaccine out to them. And then last thing is, as far as vaccine data, I know people are always wanting to know kind of how many doses and a lot of the different data around vaccinations. And so we're really pointing people to the Department of Health vaccine dashboard. They really have done a great job of gathering data, including ethnicity and race data on there. And that's going to be the most current and accurate place for you to find vaccine data. So with that, that's the end of my report for vaccinations.
Hey, Tiffany, there is a question in the chat about the information included in the SITREP for clinics that have been done in the vulnerable and marginalized populations outlined in the next SITREP. Is that something, I know we have that, we could probably just add it in.
So which clinics are being done?
Clinics that we've done in our vulnerable and marginalized populations, the ones that we've done out in the community centers, to get to different populations. Sarah, it looks like Sarah just unmuted.
Yeah, just something high level, Tiffany. I'm just curious. I know you guys mentioned last week, Dr. Velasquez mentioned some of these outreach, and I was just curious what groups and how we've targeted them, just for knowledge.
Yeah. So according to the most recent race and ethnicity report that came out from Department of Health, those that are Hispanic, Black, and people of color are being vaccinated at lower rates than their percent of population. So we've really done specific outreach to those groups. So we've done clinics in the Pacific Islander population. We've done clinics at the Martin Luther King Center. We've had many conversations and clinics with the Latinx community. So yeah, those are the key cultural groups that we're reaching out to. And then, like I said, some of the other vulnerable population groups are some of the more rural areas and the elderly that may have access or other barriers that we're trying to find out where the gaps are there. Does that answer your question, Sarah?
It does. I just wanted to be able to track over time what populations we've hit. There's also, I'm sure you know the other populations, Ukrainian speaking, Russian speaking, Vietnamese speaking, just trying to document that over time. So if possible, if we could get that in the SIT rep over, the next couple of reports, that would be really helpful.
Sure. Yeah. And we are working, again, Slavic community is another one. We have many community health workers, both within our agency and working with out in the community that have done a fabulous job of connecting with some of the different populations. So.
Yeah. And Dr. V, it looks like you wanted to maybe add there. I saw your hand.
Yeah. Actually, Tiffany mentioned our community health workers that have very specific language skills, by the way, have helped with that. As an example, last week we did a presentation under the auspices of Latinos in Spokane, and it was aimed specifically at an upcoming vaccine clinic. With testing and vaccine, and that had, I think, 277 views. And when it finished, 27 people called to register for the vaccine. And that's a group that, particularly younger population and those that can be qualified as essential workers, Spanish-speaking origin, have a higher level of hesitancy than those that are 50 and above in the same ethnic group, who see that as part of their duty and have a little bit more confidence in the vaccine. So we're targeting very specifically, particularly since we have the data about where the hesitancy may be in those specific populations, because it's not an all-encompassing statement, and it varies depending on age and other parameters. And our equity task force is really working very closely with our vaccine team, because they do have representation from all those communities, as well as contacts in those communities that we're leveraging to make sure that we're hitting all at the same time. So I'm sure the team can put something a little bit more comprehensive. This is just off the top of my head, but it's a very good question, something that we're focusing internally.
Thank you all. That was really comprehensive. Thank you so much.
Sure. And then can I, Tiffany, it looks like did you say when phase 1B2 might open? That's one of the questions in the chat. I heard you mention it, but I didn't hear a date. Wasn't sure if there was.
Yeah, so I just responded to Alicia. Good question. We don't know. And the governor is the one that makes that decision. And we usually don't know that decision has been made until maybe when we hear it on the news sometimes, or just shortly before that. So, but I do know that we are still a long ways locally from vaccinating those that are in the current phase we're in. So we're still, with the limited doses we have coming in, there's still a number of people in our community in the 65 and over and 50 and over in multi-generational households that we still have left to vaccinate. So I did want to mention one other thing that the governor has talked about is combining additional tiers into one, and as we move forward, but again, that we're trying to just go phase or tier by tier until we make sure that tier has been vaccinated to the best of our ability before we move on to the next tier.
Thank you, Tiffany. And Commissioner Cuny, I think Commissioner Kearns was trying to ask a question a minute ago, so let me. Commissioner Kearns, are you still
Yes, my question was with the racial disparities that were referenced from the Department of Health. Are those statewide numbers that are showing that disparity, or are those for Spokane County? Are disparities here? Do they track with the statewide averages, or are there different percentages when you compare locally in the county to statewide as far as disparities?
I think Steve might be best able to answer that question, but the numbers that I referenced were state level data.
Steve, are you able? I don't know if Steve had to drop off. Do you have he's on there. Do you have any additional information on race and ethnic group locally for the vaccine?
For the vaccine, it's really hard to get locally. Anecdotally, we would say it's probably tracking about the same within the group, and we're working on trying to pull that a little tighter.
Thank you, Steve. Commissioner Cuny, do you want to hop in with your question?
Yeah, so the question on the vaccines is, with Johnson & Johnson now coming out and getting shipped, does that come through still the federal feds to the state to us? And so no one's going to really know who's getting that vaccine versus the other two. And so just wondering, like at the clinics, does it, not that people are going to have choices, but I'm worried people are going to kind of shop. And I know, Dr. V, you can probably speak to it too, but the important thing is to get vaccinated. And certainly, everything we're hearing, it's certainly not necessarily a lesser vaccine. I think there's some public perception that way. Do you know, is the state going to do any marketing on that, or is that up to us to try to get the word out to citizens that, just get vaccinated? I don't know, have those been answered?
Yeah, and I can respond to that a bit. We're actually, we've already started working internally on getting some of that messaging out. And also the CDC has provided some messaging on to the point of what you're talking about, for consumers who are looking at which one to get. And, if there are questions, concerns, or, people wanting to wait and get another one versus not using the Johnson & Johnson one, or not using Moderna or Pfizer, or, just based on what people are hearing. So our vaccine task force has everything that the CDC sent out over the weekend. But it is still that whole process of it comes in federally, and then it comes to the state, and then it comes locally. And if you watch even over the weekend, so when Dr. Shaw was here, he mentioned that the message really needs to be, if you have the opportunity to get a vaccine, get it when the opportunity presents itself. And Dr. Fauci actually had that same message from the federal level this weekend, just saying, in terms of efficacy, all of them are right around the same amount. It's very good efficacy when you look at just vaccines as a whole. So really just pushing that message of get it when it's presented versus doing the shopping, because there have been instances where people who qualified in that 1A group wanted to wait, and now they've waited and it's harder to get them in for a vaccine. So yeah, I think to your point, Commissioner, we need to continue to push that message forward.
And I think it's going to be important as elected leaders for all of us to be, kind of saying the same thing too, to make sure that we're getting that message out as people ask us, because, as you know, we're out in the community and people are asking us. And so I think it's just really important that the important piece is to, whatever vaccine is available, take that vaccine so that way we can protect the community and themselves.
Yeah, absolutely. Dr. V, I think you wanted to weigh in there.
Yeah, so thanks, Amelia. So, Commissioner, I think it's very important that when we talk about efficacy, you can't really compare the three vaccines. And the reason for that is because the parameters for efficacy were different for all three. Pfizer, Moderna use either Class A symptoms and or a positive test 7 to 14 days, depending on which vaccine. And Johnson & Johnson use Class A symptoms positive test 28 days into. And it was also tested at the time when the variants were already around the world. So that's why it shows a little bit of geographical variability. For example, it performed really well in the US. When the studies were made, that's where the 72% efficacy comes from, as compared to South Africa, for example. But it's 85% or better effective in preventing severe disease and mortality, which is basically the point behind a vaccine. So when you look at efficacy, you have to look at what the details behind that number is. But what it boils down to, all three are really good at preventing the things we want to prevent, which is serious disease, hospitalization, and mortality. No vaccine is going to prevent the potential transmission to a person. No vaccine is 100% effective, but all of these vaccines are really good at protecting us from the things we want to protect us, the people. And I think that's part of the conversation that we're messaging here. And we've done that a little bit on our Facebook Live, and we'll continue to do that, particularly as the J&J vaccine comes out. Because at the end of the day, it's a matter of which one is more readily available to you at the place that either you have an opportunity or you've chosen to go to. It makes basically no difference. If you don't like needles, like I don't like needles, I would have loved to have a single shot just because I hate getting vaccinated. I do it every year with flu, but it wasn't available, so I just took what was available when my phase came in and said, okay, it's your turn. So I just went and got it. So I think that's the message. And I think what has confused people is this statement the efficacy is not as high. Well, that's apples and oranges. When you look at what we're trying to prevent, all three are good. So better than any flu vaccine that we've had thus far, for the most part, actually. So anyway, just wanted to add that in, and we'll continue to add messaging so everybody, and I appreciate our elected officials, since you're out and about, we'll give you those talking points so you can keep repeating those, because it is important that as many people get immunized as possible. We're not going to get to herd immunity by exposure. We're going to get to herd immunity by immunization with some exposure contribution. So that's important to keep in mind.
Thank you, Dr. V. And thank you. I mean, this whole group has been great about helping us get messaging out. So appreciate all of you taking that forward. Want to make sure here we hear from GSI. So Alicia and Kara, if you want to hop in. We can't hear you, Alicia.
Am I having a reaction to my vaccine shot, or is she muted?
She's having technical difficulties.
Okay, just checking. I got nervous.
Yep, you're good.
All right, let's see if I can do this justice. We had some notes back and forth. Sorry, going back through text. We just have a couple things. There is I think she's going to try to come back in, but really our state portal for the Department of Commerce for grants is still on track. That is the $240 million that is allocated to businesses from I believe it was 1.2 billion at the state level. And so that is on track to be open by the middle of March. And it will be different than the grants from previous rounds. But we're meeting with Commerce regularly. And so we'll be able to get information out on that when it's launched. Let's see if if we can hear Alicia. The other piece, well, now it shows you're still muted. I don't know if I'll just continue. The other piece is the PPP, which we've had, I believe we have 3 staff that have been in training so we can assist folks with questions. And are you on, Alicia?
I don't know. Can you hear me?
Yeah.
That was weird. I can hear all of you and then none of you. I don't know what you said, Kara.
So I talked about the state portal for commerce, and then we were just discussing the PPP. Last week was opened to businesses with 20 or fewer, really trying to, it's purposeful, trying to get that money deep within the economy into those smallest businesses, which sometimes have had difficulty accessing PPP in previous rounds. And so we have a couple of staff that have taken a lot of training and would be able to assist people. So if anybody gets questions about that. And then the first piece, Alicia, was the AWB. So I wanted you to handle that one.
Yeah. I'm just going to add on to the PPP update that we're ADOs across the state of Washington are part of a statewide Washington Small Business Mobilization Campaign for PPP between now and the end of May. And so there is a whole set of tools that have been created. Everything's at smallbizhelpwa.org, and we can share that with folks, but everybody's helped to get that out. Where Washington State set a goal of $6 billion of PPP in this round going to small businesses in our state, and we're about halfway there. So wanting to make sure that any business that has the opportunity to access that relief is taking advantage of that. And specifically now they also, we have new micro enterprise development organizations that are also helping to reach both into our multi-ethnic business community in a deeper way, as well as these particularly really small businesses. And so both AHANA and the SNAP financial access here in Spokane are partners now in that effort as well. And so we can share some of that information, but also looking for this partnership just to help through your communication channels, getting folks pointed to those resources, and then they have counselors specifically available to help assist these small businesses in navigating the process, getting connected to funders, those kinds of things. And then the last thing I was going to add is to both Dr. Velasquez and Amelia, to your conversations around phase 3, and then Mayor, to your comments on what you've sent as a group of mayors. We're also engaged in some conversations with the governor's office, the first one this week through AWB and the chamber community, talking about phase 3. And so I would love if there is, if you can share some of your thoughts. I've asked AWB for what they're looking at their recommendations being, so we can share them back. But would love to be able to articulate 2 or 3 of the same points when we think about what phase 3 and reopening looks like here. So if folks are willing to share that information or ideas, that would be super helpful so that we can coalesce as a region on what phase 3 looks like. And so that meeting's happening this week with AWB and the largest chambers across the state. I think those are my updates.
Yeah, and I think, thanks, Alicia. We're happy to fill you in on what we're thinking. We actually, WASALFO, the Washington State Association of Local Public Health Officials, were asked to come to the table, and so they have regional folks who are signed into that conversation. And then I think Dr. V shared that first meeting is maybe this evening with Department of Health. Just to start, having conversations. And one of the things I'm really happy about from our region is that there aren't very many health officers participating in that conversation. And I think by having the health officer expertise at the table, with Dr. V's voice being there, is going to be really credible, add some credibility to the conversation, and hopefully have some impact. But I think we can share that with you. And I think if the maybe Sarah or Scott, could you send us over what the mayor letter that had all the signatures, just so we kind of have that to see?
Yeah, Dr. Velasquez just asked for it in the chat, so I just forwarded it to you and him.
Perfect. Can't always keep up with the chat when I'm watching everything, so appreciate that. Any other questions, comments, things that we need to make sure we talk about at the next meeting? All right. Well, as always, appreciate everyone's input and just support as we continue to work through this. I think here at the Health District, one of the things I've been hearing over the past week is we know we're not there, in terms of being done, but we definitely feel it feels like things are moving in the right direction. So, it feels like relief and things are getting better. So definitely appreciate everyone's input and look forward to talking with you next week. And if anything comes up in the meantime, just reach out to us. Appreciate it. Bye-bye.